to win. What did we do to win? And that is, how did we develop new leadership models? How did we build new coalitions? How did we create what we call vertical organizing and horizontal organizing, which is collecting people through healthcare justice? That would be vertical, and then horizontal would be across all social justice groups. How did we assemble the necessary resources? How did we build ourselves out in capacity to overcome the powerful interests that are dead set against our achieving our goals here? How did we build out short-term, long-term, and midterm goals? And so what did that look like? How did that work? That's the kind of thinking that's involved in building out effective strategy. It's important to do all of this work, and it requires really stretching our minds. And I don't mind saying that I've been doing this work for 50 years, but also the first 45 of these years, I was struggling because I didn't have that sort of radical visioning technique. I learned about it when I was a teenager. I read a book called Looking Backward. Edward Bellamy wrote a book back in 1897, or 1887, excuse me. And he was writing it from a dystopian Boston. Boston was suffering from the pains and agony of the robber baron era, of the Gilded Age, Boston, 1887. He writes this book projecting to the year 2000. It's really a science fiction book, but it creates a utopian vision for the future. And this character from 1887 is transported to the future. He wakes up, and then he's greeted by his home host, who's a physician in Boston. And he looks around and he sees a society where people are taking care of each other. And he cannot believe his eyes. But then he begins to ask his doctor friend, how did we get here? And that's what the book is about, Looking Backward. It's a discussion of how people were able to come together, set aside their differences, and unify around common human needs, what we in our Constitution call the general welfare. So that's the basic concept that we're talking about tonight. Radical visioning, seeing the future, seeing our having accomplished this goal, not 100 years from now, but really we're talking 7 years from now, of accomplishing national Medicare for all, as well as national housing for all, as well as reforms across the board in terms of climate, policing, education, food, and so forth. So this is the way that we're looking to go forward in this effort. So I'll stop right there. And what I want to do is share with you very briefly a document just to peek at, just to see what it is that we're working off of. And anybody who wants to get a copy of the document, just send me your email, and I will happily forward it to you. But basically, this is a document that is the result of dozens and dozens of conversations that I've had over the last 4 years with organizers across the country. It's really quite an eye-opening document that is the result, again, of collaboration with others. So let me just, Mike, I've got the Zoom, right? I can do a share. So just to take a peek at this. As I outlined a few minutes ago, this is what this looks like in concrete form. And that is, how do we think about strategy? It begins with envisioning the success, then reverse engineering what that winning strategy looked like. It means defining what strategy is. It means being clear about what are our strengths, weaknesses, opportunities, and threats. It means embracing the politics of people, politics, and policies, which I touched on. Horizontal organizing, which is, again, organizing social justice groups across the network, as well as vertical organizing, other healthcare-focused justice groups. And there are differences among and between us. We need to set those differences aside and work with each other. And if we differ on tactics, then keep your powder dry. Step back and let others move forward with how they think that we can do this. We need to link all of our issues together, which brings all of our people together. Again, new leadership and decision-making models, communication strategies, both internal among ourselves, as well as external, mindful of our values and ideas, power of story, language, connecting to people's hearts and heads, as well as building organization, as well as identifying who and what we're up against, development, that's resources, timelines, measure, quantify, and qualify our goals, and then bring it all together and ultimately asking ourselves along these terms, how did we win? We won in the streets, we won in the suites, we won offline and online, we won in rural America, suburban America, ex-urban America, and urban America. And we won in all the capitals, state and national. Again, what did that look like? And then finally, there's a great historical resource, which is to say that this has been done before. This work has been done in 1,000 different ways over the last 100 years in more than 160 countries. There's a database, it's called the ENVY database at Swarthmore College, and I'll drop this link into the chat as well. It's a great resource. It's important to remember what the civil rights movement did in this country, which was the last real revolution in this country. But we need to learn from what we've done successfully here as well as around the world. And I think this points our way to a successful future. So with that, let me turn it over to Patricia Chadwick. And Pat, do you want to just introduce yourself a little bit and then let us know how you were able to use radical visioning to achieve what it is that the disability rights community was after? Thank you.
Thank you, Chuck. Yeah, again, I'm Patricia Chadwick. I've been a longtime advocate for single-payer healthcare and also for disability and racial equity in the healthcare system. And I'm also working on a disability history museum. So I'm going to talk about some of the lessons we can learn from the disability community and their fight for civil rights and the passage of the ADA, as well as other legislation. And then I'm going to do a short visioning of what an ideal single-payer healthcare system would look for, like for people with disabilities. And although, we're still not a perfect world for people with disabilities, a lot of progress was made in a relatively short period of time. First of all, against all odds, in the 1960s, people with disabilities began to see themselves as a group worthy of civil rights and as a diverse group where people with a wide range of disabilities, ethnicities, and sexual identities could organize together. Because of the stigma that existed and still does, this was an act of radical imagination. Prior to this, there were organizing efforts by people with disabilities, but they were often focused on one type of disability, and they often excluded people of color and other identities. For example, in the protest in 1977 to enact Section 504 of the Rehabilitation Act was comprised of deaf, blind, physically and intellectually disabled people. It was supported by other civil rights groups like the Black Panthers and labor unions. And it's important to communicate to other groups how your fight aligns with them and how attaining civil rights for a specific group can benefit others who are not in that group or not yet in that group, because anybody can become disabled. And just, protesting against something or a government isn't always successful. There needs to be a plan for what you're going to do to improve things. And from early on, disabled people organized around specific, clear goals. In the 1930s, a group from New York, a group of people with physical disabilities, protested to get the Works Progress Administration to employ people with disabilities. President Roosevelt, even though he was disabled, claimed that, disabled people were unemployable, which is kind of ironic. But, and they eventually were able to get the WPA to start employing people with disabilities. The Americans with Disabilities Act owes its passage to thousands of people who worked for years prior to that, organizing and attending protests, testifying, filing lawsuits, and drafting legislation. Activists even secured support from Republicans who had disabled loved ones. And they didn't allow politicians to divide them. The activists insisted on keeping protection for people with HIV and AIDS in the ADA, despite pressure from some conservative politicians who wanted to deny them protections. People with disabilities also employed dramatic tactics to get the public on their side and ultimately obtain rights. the ADA was being, were dragging their feet on passing that because there was pressure from transportation groups and other groups that were trying to weaken the regulations. And so people with disabilities they got out of their wheelchairs and crawled up the Capitol steps to publicize the fight for that. And that did get passed without weakening the regulations. When the Republicans tried to gut the Affordable Care Act and to roll back Medicaid expansion, they staged a die-in outside Mitch McConnell's office. People got out of their wheelchairs, and then the police were dragging them, which, those images went viral and got the public on their side. And that also, the efforts by the Republicans did not get passed. Another reason I think for the success of the disability rights movement there isn't a focus on one charismatic leader or liberator. Although having a charismatic leader can sometimes help a cause, it's also good to acknowledge and celebrate the communities that shape and support the cause, and encourage participants to contribute to the decision-making and know that they have a voice as well. More recently, disability justice activists are redefining what justice means and how people with disabilities can work together with others for a more just society. So their principles include acknowledging the intersectionality of our lives, leadership by the most impacted, anti-capitalism, cross-movement organizing, and organizing for sustainability, interdependence, and leaving no one behind. So in terms of what a single-payer system, ideal single-payer system would look like for people with disabilities, our single-payer system would include, or does include, long-term care at home or in a facility of the participant's choice. It includes in-home supportive services for people who need personal assistance. Pandemics and other public health emergencies are responded to in a coordinated manner with consistent messaging that protects older people and people with disabilities, as planning has been put in place that addresses the needs of these populations. We saw during the COVID pandemic that people with disabilities and older people are kind of seen as dispensable, like let them die so that, you can get this over with. But in our current ideal system, that would not happen. These people would be protected. Medical facilities now are accessible, including accessible equipment and communication, and the staff has been trained to assist people with various disabilities and to listen to patients without being dismissive. People with disabilities can easily access reproductive health care and acknowledge that they do have reproductive health care needs. Free mental health care is included as part of the healthcare system. Requests for equipment and assistive devices are handled in a timely manner. Any process for approval or denial is transparent, and restrictions on where equipment can be used have been lifted. There are some, I think it's under Medicaid in some places, you can only use your wheelchair in your house, which seems kind of ridiculous. So those kind of restrictions would be lifted. And also, other devices that, like cushions that prevent skin breakdowns, are covered. When patients are released from a hospital or psychiatric care facility, there are transitional housing options available if they don't have a place to go. And there's respite care and peer support. So they get support from people that have been through their similar situation. The system has more flexibility with regard to specialty care, or treatment and drugs for people dealing with multiple and rare conditions, so they don't have to fight for everything they need. If somebody has a condition that is, possibly terminally ill, or they would, then they can use experimental drugs without being questioned about it. This system also includes access to alternative healing practices that can be provided by Indigenous communities, which benefits them economically as well. Our single-payer system allows for resources to be distributed more equally to underserved communities. So people with disabilities who live in rural areas or low-income areas get quality care. And there's a feedback mechanism in place for listening to communities that have been traditionally discriminated against so that their issues are heard and acted on. This system was accomplished through solidarity by forming alliances with disability rights organizations, educating single-payer organizations about disability issues, and reaching out to more conservative groups that deal with disability, such as veterans groups. We also used civil disobedience and street theater to publicize the issues around healthcare. And we developed scenarios for different groups of users so they could envision how a single-payer system would work for them. That's it. Thank you.
That was excellent, Pat. Very appreciate, very much so. A wide range of tactics that are connected with a radical vision that creates a strategic plan. I hope we can all hear in Patricia's presentation and Pat's presentation, how very thoughtful steps are woven into a larger strategic plan. And it's essential, learning from the civil rights movement as well as now the disability rights movement. Keep your eye on the prize, right? Stay focused, don't get distracted, don't allow others to get in your way, build out your coalitions and use creative practices. So thank you so much for that. Appreciate it. So let me just open this up for a few minutes of questions. We'll start there and then we'll bring in more questions on the back end. But while people maybe have anything fresh in mind, let me turn to the panelists first to see if they have anything, and then we'll open it up to the larger group. Simon, Lydia, do you have any questions of Pat?
Yeah, you want to go? You have something, Lydia, or can I go?
I just have a comment and a question. Every time I hear you, Pat, present, I learn something new. So thank you for that. And I feel your emotion also when you present. So thank you for that. My question is, when you were talking about how people organized, sometimes in my work, some of the representatives from the disability community are fearful of one payer, universal health care. They're fearful that they need more information, or we need to answer more questions through a study, formalized study. What is your advice on how to handle that?
Yeah, I think like we did hold a summit that where we brought in people from the disability community to listen to their concerns, and I think that's just and then developed a white paper from that. So just doing more outreach to disability groups and communities. I know initially that Medicare for All was not the term that was, was a sort of shorthand, and that was not positive in the disability community because Medicare doesn't cover things that Medicaid covers, which, like in-home support services. So I think using different terminology like, expanded, improved Medicare for All, or single payer, universal, but then, also the outreach and making sure that, we're including those concerns in our legislation that we do, state by state, and the national, of course. Thanks, Lydia.
Thank you.
Thanks, Lydia. Simon?
Yeah, I actually wanted to ask, because you discussed politicians, for the disability sort of movement made sure that the politicians didn't divide them. Could you expand a little more on the ways that perhaps politicians opposed to the movement tried to divide the movement and were unsuccessful in doing so?
Well, with the ADA, it was the HIV/AIDS thing, that they didn't want to offer protections to people with HIV/AIDS. And that, I don't know specifically how they thought that, but I think they just said, no, we're not going to exclude them from the legislation, because it's going to cover anybody who has a, illness or chronic illness or disability. And there were other, with the, let's see, with 504, they were dragging their feet on signing that legislation, I think because of pressure from that one was, there was actually pressure from churches. They didn't want to have to, and that was the ADA as well. They didn't want to have to make their churches accessible. So there was, you know, oddly pressure from the churches and then other special interest groups like transportation, because they didn't want to have to make their buses accessible and things like that. So I think it was just, you know, determination that we're not going to back off. These things have to be included, and then, you know, eventually it's like they're not going to, I don't think these groups wanted to be seen as like totally, you know, sabotaging the legislation. So at some point they backed off. But I'm sorry, I don't have much more specifics than that. But.
All right, yeah, thank you.
Terrific. Thanks, Simon. Thanks, Pat. Let's open it up for folks in the larger audience. People have questions for Pat? I can't see everybody since Pat's spotlighted, but if you have something, throw up your hand. I think I saw a hand. Bob?
I thought your summary of the services included in Medicare for All were really long, and awful lot included in there that I'm certainly not aware of, you know, day by day. I just wanted to clarify that all of those are currently found in Medicare for All, HR 3421 and 1655 in the Senate.
Are you asking me, or did you say?
Yes, those are all.
Yeah, I think the long-term care and the in-home care are included in those bills. I don't know about the equipment approval. I haven't
Okay.
seen that, but
most of what you said is already included in the bills.
yeah,
Okay.
I mean, that was just a visioning, but
Right.
that, you know, but the thing is, you know, like with the other disability legislation, people can push back and say, you know, that they don't want to, they want to exclude that. So that's
when
just
we
making sure
say-
that we keep those in there.
When we say all necessary care is provided, we can say that with pretty much a surety.
Mhm.
Okay. Second little question I have is, Pramila Jayapal has included an equity committee in her legislation. Do you know anything about what they're doing or what changes they might have made with that committee?
No, I'm sorry, I don't
Okay.
know. Somebody else might know
Okay.
about it.
I mean, just to reinforce Pat's point of Bob, that the reason that that list that she ran off is all but included is because to Pramila Jayapal's credit, you know, in constructing the new Medicare for All legislation, stakeholders were brought to the table, but it required fighting, right? I mean, you had to fight for it. So it didn't just happen automatically. I think people need to see that, and I'm sure you do, Bob, as well, but it's not like it just happened. This is all intentional, deliberate, organizing, lobbying, education. And I was on a call yesterday with Pramila Jayapal, and I'll follow up. I will see her again soon. I'll ask her about the equity committee. If you want to drop your question and email into the chat, we can follow up with any questions that you might have. Thanks, Bob, for that. Appreciate it. Mike, your hand is up.
Yeah, Pat, in retrospective engineering, where did you and where do you find the strength to fight like you have against what might have seemed insurmountable odds?
I'm sorry, can you repeat that question? I didn't hear the first part.
Where did you, this is retrospective engineering that Chuck likes to talk about. Where did you find the strength? Where do you find the strength to keep fighting against seemingly insurmountable odds?
Oh, well, personally for me, I mean, I have a family background of people who have been fighting for single payer healthcare from my great uncle on down. And I just feel like it's got to be done before I die. So there you go. Yeah, it's, you know, and for the future of my kids and the country, you know, I just don't see any other way for us to go forward without having a better healthcare system.
Thanks.
For that. Yeah, I mean, accompanying radical visioning, right, is radical hope, radical persistence, radical determination. It's going all in with that focus and not allowing yourself to be deterred. So congratulations, Pat, on your story. And it's really, it's telltale for us. I think a lot of people get frustrated in the moment and lose sight of the larger picture. You know, reminding ourselves of Martin Luther King's talk about the arc of just, or the arc of justice. You know, it covers all of our history, right? That we have to understand to take big picture view of things and just stay persistent and connected with one another. Do other folks have questions at all for Pat? If you have some more on the back end, we'll take those up. If not, people are dropping resources into the chat, which is great. I would ask people to consider helping us out with a few bucks if you can handle that. You know, the work that we do, we're not paid to do here in DC. You know, but anything you contribute will go a long, long way to making sure that our members are educated on the legislation that we're working on. So let's turn it over to Lydia. Lydia, Mike, do you want to spotlight Lydia at this point? And Pat, again, thank you so much. Lydia Guzman from Denver, Colorado, the Mile High City.
Hello, everyone. My name is Lydia Guzman, and I live in Denver, Colorado. I am president of Healthcare for All Colorado, and where our mission is to have a single-payer universal healthcare in Colorado for everyone and nationally. We support national legislation, and we support other work of other social justice groups. But for right now, I want all of you to come with me onto this time machine we're all going to be on for the next few minutes. And I want you to go with me to the year 2030. So you are now in 2030 in Denver, Colorado, where we are all celebrating that we just passed the single-payer universal healthcare plan, and that every single Colorado is covered with every service possible, including dental, vision, mental health, hearing, and long-term care, and that everyone has every service they need, and that no healthcare is tied to work or jobs, and that everyone has the ability to access the healthcare they need, and that it is very affordable for everyone. So in Colorado, we are celebrating that right now. You are with me celebrating this. And I want you to imagine that you are celebrating this where you are now as well, in your own state, that it's happened. And think about how much celebrating you're doing right now and how critical it is, because the work you've done has come to fruition and everyone is on board. The whole state is seeing a boom in their healthcare services, as well as there is no longer any bankruptcies that we have to speak about. Hospitals are not taking anyone to collections. Everyone has the affordable healthcare that they need. So you're probably wondering, how did we get to this point? And what was involved in building this momentum and this movement that was created through the coalition building and the organizing that happened behind the scenes to help have all of this happen. So I want to give you some background of how we did this in Colorado. So I wanted to share with you how we organized ourselves horizontally and vertically, and we used the strategic plan for one-payer states, as well as our own strategic plan. And horizontally, we looked for how things intersected horizontally and vertically. And first, we looked at single-payer, other single-payer groups. And then we added groups that had social justice issues and community-based organizations that had social justice issues as well. And we also had the medical professional organizations come on board and be supportive. And what we quickly found was that we had to have a broader base of support. So we really focused on coalition building and organizing. And we worked with groups that had the same mission of equity and racial equity and voter rights, women's reproductive rights, faith groups, immigration groups, energy and environment groups, and some of the unions as well. And then nationally, we look to working with organizations like one payer states who had a lot of resources they could share with us, as well as the other states that are in one payer states. We use them as a resource as well to help organize and build our strategy. So what we did is once we looked at all these organizations, we were able to get 60 organizations on board to help us in pushing this legislation through the legislature at first, and then getting it onto the ballot for people to be able to vote for this. We started with a group of like 7 organizations and that had like-minded one-payer universal healthcare missions. But then we moved to organizations who didn't necessarily have just one-payer universal healthcare as a mission, but had other social justice issues that we could support, and got them on board to support us as well. So what we did was we got these organizations together, and we formed what we call the Alliance. And so in the Alliance, there were 3 of us organizations that got together, and we paid for a lobbyist. And then the lobbyist came on board to help us push the bill forward. And it also helped us leverage power in all of our groups, because no one organization could take over. We agreed to rely on the lobbyist, and having the lobbyists work for the legislators and bring us back communication. We also had the legislators meet with us monthly if they were available. It was harder during the legislative session, but we met for 2 years to get this work done. We also had the nurses, Colorado Nurses Association support us, the Colorado Dental Association, the Colorado Mental Health Association, and an organization called Consumer Health Initiative in Colorado, because they not only support universal healthcare, but they also support people in making sure they don't end up in a bankruptcy, or that they aren't. If they're in a collection, then in collections, then they work with them to help them resolve the issue to get out of collections. So those types of groups we worked with. We also worked with the League of Women Voters, and we supported voter rights and women's reproductive rights. I did not put all the organizations we had here that we were working with, but I did want to just give you an idea of some of the ways we worked vertically and horizontally. Most of the work was within the state and horizontal among all the organizations, and we looked at points of intersection, like with the League of Women Voters, we supported the voting rights, the reproductive rights, mental health rights, like I mentioned before. And then horizontally, we looked at national organizations like One Payer States, PNHP, and other organizations who would share resources and were easily accessible to help us strategize. And that's what I have.
Beautiful, Lydia. Thank you so much. Yeah, there's a lot to unpack there. and I mean, as Ira said in the chat, just the way that you vision this is really, really an important core idea for for moving forward and staying focused on the goals that you're working toward. Really, really good work that you're doing. And the congratulations to you and all the other states here in the year 2030. And now next Congress, we're going to pass National Medicare for All 2031. So you set the table, as did other states. So thank you for that work. So let me throw it over to our two panelists, and then we'll open it to the larger group. Pat, do you have any questions or comments for Lydia? Pat, and then Simon?
Yeah, Lydia, that was great. I really appreciate that process that you went through. But I just wanted to clarify, was it through a ballot initiative or a bill, a legislative bill that?
It was a legislative bill that led to
Oh,
a ballot measure.
Okay,
Vote of
so,
the people.
okay, so the ballot measure was voted on by the population or the people in Colorado.
Yes.
Okay.
In 2030. In
Okay.
2030.
Yeah. All right. Thank you. That's all I have.
Thanks for the question, Pat and Lydia. Simon, do you have any thoughts?
Yeah, I do have a question about the alliance. So as we all know, we're all in this space and have very strong opinions often about how to make the world a better place. So how, with such a large alliance of organizations, how did you sort of resolve disputes and manage to maintain that alliance when people had strong differences of opinion about how to achieve the goal or goals?
Okay, that's a really good question because when we started the alliance, we divided into two parts. So there was a legislative part that met 2 Tuesdays of the month, and then there was the big picture group, which met on the other 2 Tuesdays of the month. And in the big picture, there was a messaging committee, a grassroots organizing committee, and a fundraising committee. So we had a strategic plan in the big picture group that we followed. And for the bill, the legislative part, we had the lobbyists help us with communication, and we had the legislators come in to give direction to the group. And they were very collaborative, and they asked our opinion, everything from the language in the bill to the cost of the study and who was going to do the study and what should be included in the study. And that's pretty unusual for those legislators to come in and help us do that. So that kind of helped leverage the power because the legislators were doing that work and working with the organization that was doing the study, the first study to get the bill. After the study, then it went to the vote of the people. So on the big picture side, we had a person lead those meetings on Tuesdays, and we didn't have, the biggest disputes we had were around the cost of the bill and what should be included in the bill, and the services that needed to be included. But in the end, everyone agreed. We had consensus and everyone agreed to that. And the other thing is that the lobbyists really helped leverage the communication and the power. So there wasn't like one organization trying to take over and all of that. It was balanced because of the lobbyist.
All right, great. Thanks for clarifying that.
So the lobbyist walks in without any baggage, right? There's no prehistory. This is a person who's a professional. Their job is to get the job done, and whatever has happened, check it at the door, right? Check your history at the door. We're moving forward. Something like that, Lydia?
Yes.
Yeah,
Yes.
thank you.
Very
Thanks.
good.
Yeah. Thanks so much. Let's open it up for questions in the larger audience for Lydia Guzman. Anybody? Okay. So just to pick up on Pat's, Mike, your hand is up.
Yes, as I
Then Barbara.
recall, during part of your history, there was a group that really felt that a state-based effort was likely to destroy the Medicare that we passed in 1965. How did you talk with those people to persuade them to come along with you?
I believe that because we included the language, we expanded the services to include other services, dental, vision, hearing, mental health, long-term health. And we had a person from the disability community also guiding the questions that should be asked in the study, that because we were inclusive of getting PNHP on board, doctors from PNHP, the Nurses Association, the disability community, the League of Women Voters, other organizations who didn't exactly have the same mission as us, they came on board. And it was, the biggest struggle was getting the unions on board for us. And we eventually had some leadership that came within our group and helped us get them on board.
Okay. Thanks, Mike. Thanks, Lydia. Barbara Commons. Hey, Barbara, you want to unmute? Let's see, Barbara, you're muted.
Hi, everybody. I just did a quick profile for Colorado on Follow the Money, and I put it in the chat. And boy, Colorado office holders take a whole lot less money than California. Their total amount they take from the health industry and the insurance industries is the same amount that just our governor alone takes here in California. And I'm sure that helped your success in your campaign. So if anybody wants me to do a profile on their state, I'd be glad to. Just put your name in and your state, and I can, your email and the state, and I can do a similar one. The figures that you see are from 2010 to 2020, and maybe a
Thank
little
you.
further. Okay,
Thank you.
you're
Yes.
welcome. Great job.
Yeah. Great. And that's a great resource, Barbara. Thank you so much. Appreciate it. So I just wanted to welcome some people into the room who weren't here at the front, just to welcome them in. Bob Mason, welcome. Eleanor Christensen, David Sonneborn, Ken Frishoff, Angela Gardner, and Pam Gronemeyer. If you could indicate in either in the chat or I guess on the participants function, I guess you can indicate in your own box where you're from. And people are feel free to drop your email addresses in here. I'll give you my email address. The point is to stay connected, to share resources, to learn from each other. This is not, it's not a simple process. Sort of changing the way we think about the way that we do our work. And the question I ask people is, are you here to win? And are you here to do what's necessary to win? And what's necessary to win is not repeating the same activities over and over and over again, right? Isn't that what Albert Einstein says? Is that's the definition of insanity, continuing to do the same things. So we've got to be thinking fresh, as is being offered so far tonight from Patricia and from Lydia. And next up is going to be Simon. And so that's what this is about, is sort of stretching ourselves and pulling ourselves in a direction of thinking that can build on past successes using that nonviolent database archive at Swarthmore, and learning from the process that Edward Bellamy taught me anyway, in terms of looking to the future, looking backward, and that's the way I think we're going to move forward. Barbara, your hand is still up. Did you have something else, Barbara Commons? No, I'm guessing not. You're done. Okay, let me turn it over to Simon. Simon, do you want to jump up and give us your thoughts? And then we'll finish up with you and then have some wind up comments and then let folks get on with the rest of their evening. Simon.
Sure. Hey everyone, great to be here. Glad I could join you with the new time travel update for Zoom that we're all participating in here with our visioning exercise. I'm gonna pick up where Lydia left off. I'm going to crank the dial 1 year later to 2031, where, as Chuck said, we've achieved national Medicare for all, national single payer healthcare for all of the United States. And I'd like to, in our celebration of that, I'd like to have a discussion about how we not only managed it in Colorado last year, but this year we've achieved it all over the country. So there were obviously many factors to our success, but a huge one, perhaps I would argue the biggest, was building the coalition we needed to win. And what that meant was communications, internal, external, between organizations, outreach within our own organizations, and finding common ground and a way to move forward and achieve victory together. And I want to note that not only in 2031 have we achieved national Medicare for all, but we've also achieved significant victories in other social areas of social justice. We've funded education. We've passed significant legislation to address climate change. We've provided housing for many more Americans that are houseless. And we did all that because we came together and built coalitions not only between other healthcare, universal healthcare and healthcare justice organizations, but even beyond. And while we built that coalition of mutual support, we also stayed focused on our mutual goals. So I'm going to go over a little bit on what that looks like and then the tools, the methods we used to achieve that. So what did it look like? It looked like we set up strong lines of communication between the leaders of different social justice organizations. We got to know each other personally. As Chuck said, people first. We got to know each other personally, not abstractly. We got to understand where we were coming from, what our objectives were, our approaches. We found common ground. We took the time to not only be focused within our own bubbles of our own issues, but we took the time to spend some effort connecting with other people, both in person and through new methods of communication online. And through that, what we were able to achieve is, while we each focused on our respective goals, when push came to shove, when in Colorado they needed to push through and succeed with their legislation, when we needed to succeed in passing the state-based Universal Healthcare Act at the national level that Chuck mentioned, which enabled states to fund their own universal healthcare systems, and then finally this year to pass national Medicare for all. The organizations could come to others in the social justice space and recognize that their issues overlapped. Health justice overlapped with climate, and healthcare overlapped with climate change, which can affect people's health. Housing, people, having housing is a big issue in remaining healthy. And we recognized, okay, we will support you in this effort to win on your issue. We will take some of our own time to support your issue that mutually supports our own. And then in return, when our time came to a crunch time, when we needed the support for our own issue, we could rely on that support as well. So what were the tools we used to succeed in that? Well, we adapted. We needed to adapt to the modern world. And that means also adapting in new forms of communication, but also refining old and tried and true methods of building coalitions. For instance, we built coalitions through interstate meetings between organizations in different states and organizations, different healthcare organizations, or even health justice organizations. For instance, way back in, I believe it was 2023, Oregon and Washington had met up to hold an interstate meeting for healthcare between Oregon and Washington. People came, they met each other, they got to know each other personally, and then through that, They built closer ties. They shared ideas, resources. They also supported each other in their online outreach, supporting each other in their pushes to share social media. They also shared resources, media resources that empowered their own kinds of online communication. They also, another thing that was done was harnessing new communication platforms, specifically within organizations and beyond organizations, such as moving beyond just email and embracing things like Discord or Slack. These other, particularly like Discord, which was used by tons of young people that needed to be brought into the organizations to revitalize the movements, adapted to new forms of communications, and then used those new forms of communication to stay in contact between organizations, to arrange meetings back and forth. That just didn't end up piling up in massive email chains. And also brought in, and again, as I mentioned, brought in many new young members to revitalize the movement. They collaborated on petitions, just like how back back years ago in 2024, One Payer States and Social Security Works and 80 other organizations came together to launch a petition in support of the state-based Universal Healthcare Act, collaborating and bringing these organizations together in a shared goal of mutual support. We also created our own media, podcasts. Organizations had podcasts, and because they built these connections, they were able to bring in guests. I mean, like even in just in the universal healthcare single payer movement, when One Payer States launched our podcast, we had strengthened ties with groups like PNHP, Healthcare Now, the state organizations like LYDIA's Healthcare for All Colorado. And we were able to bring in people to as guests onto these new pieces of media we were producing to, again, strengthen ties and also have people share their ideas. We harnessed new forms of social media, moving away from just things like Facebook, which we continued to use and share and liked each other's posts, but also got involved in Instagram platforms with short form video. So this is Instagram Reels, YouTube Shorts, TikTok. We moved into these new spaces and we supported each other by, again, mutually sharing and promoting each other's materials. But also, if people had access to some sort of subscription service that helped make videos, that helped provide resources for getting social media materials out there, we freely shared it with each other and shared these media resources to increase the profile of each other's platforms. And finally, most importantly, through all of this collaboration, we made sure to not be stopped and stymied by our own disagreements, because it's much easier to fight with the people that you are in close contact with that largely share your goals, but maybe there's some specific divisions. In the in the single payer world, that particularly came up with state-based versus national health, universal healthcare, where there's always been friction. But we recognize that a rising tide lifts all boats. Diversity of tactics and mutual support is what led to our success. And that's how we've reached Medicare for All in the year 2031. So good job, everyone. We won.
Bravo, Simon. Thank you for that. And many people have heard of the term the nonprofit industrial complex, the NPIC, the nonprofit industrial complex, which is it's a phenomenon that we were able to overcome. This is what Simon's describing, is that organizations get started and they then become sort of self-perpetuating bureaucracies. They exist primarily for the purpose of existing. And what we were able to do to build on what Simon was saying was to get folks to think in a way that connects ourselves, in a way that is mutually reinforcing, in a way that points to victory, in a way that gets us to think strategically. How are you going to win? How are we going to win? And that means bringing all of our resources together and not staying so hyper-focused on internal problems and organizational issues and hyper-focused on fundraising, but actually pulling ourselves together in a way that's meaningful and again, strategic. So thank you for that, Simon. This is a really, really great start in conversation. So let me turn it over to our other two panelists for a question for Simon, open it up to the larger group, and then let's make some closing comments, questions, and then get some of your takeaways from this evening. Some great resource exchanges going on in the chat, really important stuff. A couple other folks have come into the meeting. Just want to welcome Mary McDevitt, and I think Malia is also with us. So thank you all for being Malia Grover, for being with us tonight. So Lydia and then Pat, do you want to either way ask a question of Simon or a comment?
Yes, I have a question. Simon, it's 2031. How have you used artificial intelligence to win?
Carefully. Artificial intelligence was inevitable, and and we had to adapt. As much as myself and others may have had issues with artificial intelligence, we had to recognize it was here to stay. And how can we use it to harness it for good? How can we use artificial intelligence not to just create garbage information? How could we use it? We primarily used it as a way, as almost like a how do I say, kindling, right? Artificial intelligence was very useful. You could take ChatGPT as a specific example, to learn, to brainstorm, to in terms of crafting a message. You could put information, you used AI to simplify language down to like a simpler reading level, to generate ideas, messaging and communication ideas. But instead of just taking those and throwing them out whole cloth, we use those as inspiration, and we used it to generate resources to share between organizations and use as a tool for messaging responsibly, because we can't just ignore advances in technology, but we have to also recognize that it is our responsibility to use them responsibly, not take shortcuts, but use them to enhance our communications, and productivity in our work.
Got it. So Simon, you mentioned a lot of social media. What are the 3 top ones we should look at?
Okay. I would say, so short form video, which is not a platform, but I would say TikTok, unless in the future, I'm a little unclear on the history books, whether it was still around a few years from now. Alternatively, the other short video platforms like Instagram Reels and YouTube Shorts. Short form video is, and probably continued to be for a while, the dominant form of social media. Also a form of social media that hits above its weight class, if you will. It's like you can produce short, informative, low production difficulty videos with just a clever idea, comedy, just like make amusing, short, incisive videos that can get tens to hundreds of thousands of views. So the effort to reward for getting the message out is very good. Instagram, not Facebook, but Instagram, also very widely used by a younger demographic, much like TikTok. Harnessing Instagram Reels, as I already mentioned, which is short form video, but also just that visual platform, which is still growing, and whereas Facebook is kind of dying. And then this is more focused on internal and interorganizational communications, but Discord because you can set up servers on it that you can invite people from all different organizations to. And you can set up effective back and forth a platform to share ideas without generating massive email chains that are impossible to follow. And it's very widely used by young people. So it's very easy, like, hey, join our organization, scan this QR code, join our Discord. They probably are already on Discord, so they just add a new server to their list. So I'd say those are the three biggest that I would say.
Thanks.
And Bill Davis asked, are there Discord groups you could recommend?
One pair states. Beyond that, the main Discord group I'm involved with is a organization called Progressive Victory. This shows the strength of the which I could probably pull up. I will put a invite to the One Pair States Discord server in the chat. If you don't have it downloaded, you may need to like download it first to get it to work, but I'll put that in the chat. I don't know if I can generate an invite, but it's called Progressive Victory. It's a very, very young person focused canvassing organization that has thousands of members. It's basically entirely organized on Discord. And they are always arranging canvassing events. They did some for the Democratic primaries. Very active, very involved. They do all their trainings for phone banking, text banking, in person, all on Discord server, like voice chat and everything like that. So that's another organization I'm involved with and I really like on Discord. And I will drop an invite here into the chat in just a moment for the One Pair States Discord server.
Right. Okay. Thanks for that, Lydia and Bill. Pat, do you
Thanks, Simon. I think it's really important about your message about organizing with other groups that have other issues, and solidarity with, unhoused people and climate crisis issues, things like that. I did want to ask you if you have an opinion about what tools are most effective. Like there's petitions, there's contacting legislators and phone banking, all those different ways that we try to reach out to put pressure on legislators, writing op-eds and even offline actions. Do you have an opinion about which of those are the most effective or which are not so effective?
The ones that are effective, the things that are most effective are going to be dependent on how many people you have, like the resources you have to bring to bear, and also the level of communication between organizations. I would say when you're first trying to build out a coalition, doing something like a petition, where it's like, okay, can we all come together, agree on this language, and then all sign off on it, right? Is a pretty nice way to bring people together. I think often writing to legislators is very good. It's hard to do that as an ask. I feel like it's most effective to do that internally or like with partner organizations, like just asking people out on like social media to write to their legislators almost never happens. You have to have people who are invested. So I would say a good way to start would be going with for petitions, trying to build that collaboration, build a relationship with people. And then you can build out to actions that I think are ultimately a lot stronger, like what we did. One of our keys to victory was building a strong enough lines of communication and collaboration so that when a key issue came up for a social justice cause organization and they needed people to actually canvass or phone bank, we all got together on Discord, much like Progressive Victory does now. And we organized people from many different partner organizations to take time to canvass, to phone bank, to text bank, which had a massive outsized effect. But that wasn't possible until we built those closer connections through sort of more preliminary things like sponsoring a petition together. Does that answer the question?
Yeah, thank you. That's good information.
Thank you, Pat.
Thanks.
Thank Simon. And before I forget, just to underscore that I am here in person in Washington, D.C., and there's really no substitute but to knock on the doors of members of Congress and to get to know their staff and to get to know the chain of command and the cultures. Each office is really, it develops in line with the culture of the member. And you might be shocked to the degree to which they're welcoming and unwelcoming. But you know, the point that we're making tonight is that it's the interpersonal connection. And you can't see my shirt very well, but it is a shirt with watermelons on it. So I go forward with this shirt just to indicate this notion of radical hospitality, this notion that we've got to listen to each other. And you know, from our past intergenerational summits, I've learned from our one of our great leaders up in Washington State, who's a Native American leader of the Universal Healthcare Commission, that she reminded us, she said, my grandmother said, now you've got 2 ears and 1 mouth for a reason. It's important to be intentional in listening, make every effort to understand what the other person is saying. And then you'll find that common ground and build that relationship based on common values, shared interests, showing that you really care about that other person. Unfortunately, you know, during the pandemic, a lot of us regressed in terms of our social skills. Here we are on Zoom, which is great, you know, in terms of being able to connect us from across the country, but there really is no substitute for being in person. And so that's the value of me knocking doors. My daughter was here last week. She's from Colorado. So we went to every Colorado legislator, House and Senate, and made a point of saying, hey, my daughter's in town from Denver. She cared to carve out this time from her vacation to come and meet you and to let you know that she's committed to you're supporting universal health care. You're supporting Medicare for all. You're supporting the state-based Universal Healthcare Act. So there really is no substitute for that. So let me open it up, see if other folks have questions, and then we can put a wrap on this evening. Questions, comments? Barbara.
Yeah, hi. Thank you to everybody who put their email and state in the chat. If anybody else wants to do that, just your email and the state that you're in, and I will send it out in an email in the next day, okay?
That's
And
awesome.
Chuck or Mike, if you could save the chat for me, just to make sure I'm accurate on the emails, I'd appreciate it. Okay?
Yeah, that's amazing, Barbara. Thank you so much.
Sure.
And just to remind folks that there are petition links in the chat, so click those on. We're asking folks if you can support our work. We are always inviting people to get involved. We have several work groups: policy, education, outreach. We've got organization, development, and communications. So if you want to get involved here, if you want to just throw a few bucks in our direction, however you want to go forward, just stay in touch, please do. The work that we're doing is, it's absolutely essential. I mean, we're the lead organization in connecting the states in fighting to get modeled single payer at the state level. So thank you so much, Barbara, for your work, and everybody who's been able to hang in there for an hour and a half. This is amazing. Really, just, I don't know anybody who's dropped off. So thank you for that.